Welcome to COVID-19, Preparing Yourself and Your Family. This module will discuss degrees of separation and what people mean when we talk about flattening the curve. My name is Sam Lushtak, and I'm the owner of Absolute EHS. COVID-19 is an abbreviation given to the viral strain SARS-CoV-2, which is also known as coronavirus disease 2019. Coronaviruses that infect humans or human coronaviruses are not new to us. MERS and SARS are coronaviruses that evolved from infecting bats to infecting humans, just like COVID-19. The contagion is being classified as community spread, which means that just going out into your community and contacting shared surfaces can result in being affected. The current research suggests that COVID-19 can live on a surface for an average of 9 days if not cleaned. This length of time can be longer for items that are porous, such as fabric or wood, and less time for items that are non-porous or less porous, such as metal or plastic. Because of this ability to live for such a long time on a surface, it is extremely easy for us to transmit the disease between each other by touching shared surfaces and then touching mucous membranes, such as our eyes, noses, or mouths. I have come up with a degrees of separation exercise, which might help some of us realize just how interconnected we all are. Please recognize that this is meant as a mental exercise and a conversation starter for your family. Of course, if you have questions, please feel free to reach out to me directly by email or through my website, absoluteehs.com. First, we will write out our routine in one column, then estimate how many other people make contact with those same surfaces during each step of our day. We will evaluate the frequency of this disease in our area at the time, our personal and home's age and comorbid factors. What this means is taking into account the ages of the people in the home, as well as any underlying issues anyone might have, otherwise known as a comorbid factor. A comorbid factor might be something such as cardiovascular disease, diabetes, or something else. We then want to evaluate any direct contact's age and comorbid factors. So if you go over to help your elderly neighbor every day, consider their age and ailments. For many people on quarantine already, assisted living and nursing homes are not allowing visitors because they have already done this type of risk assessment. We then need to decide what is mandatory, optional, or not necessary. I would also like to point out that the CDC has published a risk assessment chart that you might find useful in this exercise. So here's an example of this exercise. For this example, the subject is a 30-year-old who is healthy and in a location where there are some reported cases, but it's not everywhere yet. So for their routine, they go to work by subway, potentially contacting the same surface as thousands of other people. At this point in time, this person has to go to work. It is mandatory, but they could take a bike, walk, or take a car to decrease their number of surface contacts. When they're in the office, it's a small office, about 50 people in the entire building, and they work in a cubicle, but they do need to take an elevator, use the restrooms, and the break rooms. This, again, for this person is mandatory, but they can talk to HR about potentially working from home or getting more cleaning supplies for around the office. They can take the stairs instead of the elevator, and they can bring their lunch and their coffee to avoid being in the break room. This person then normally goes to happy hour with colleagues. It's a small bar, maybe 100 people that go through it. This really isn't necessary, so we're going to suspend this activity. If you must have a drink, you can do it at home. This person then usually goes to the gym. Maybe it's a small gym, 150 people if you count the trainers and staff as well as the people coming through. This is considered optional. We can continue with extra precautions. Exercise is very good for the immune system, and it's really important to keep ourselves, stay cognizant of our own mental health, and going to the gym and working out is part of that. This person also tends to visit a parent in a nursing home, small nursing home, about 100 people if you include the residents as well as the staff. We're going to say this isn't necessary. Given this person's personal activity in public and the risk to the elderly and the likelihood of comorbid factors in that nursing home, we are not going to go. Instead, we will call that parent and/or talk to the nursing staff to see if they have video conference capabilities. Now, some people might understand why we're doing this. I know on social media, at least, a lot of people are equating COVID-19 to influenza. There are some perceived similarities, but there are some major differences as well. Firstly, the biggest similarity is how to combat it, and that's by practicing good hygiene. We're going to wash our hands with soap and water, we're going to clean our clothes with laundry detergent, and we're going to continue with social distancing. So that's a minimum of 6 feet apart. Minimum of 6 feet apart. If we look at this table, COVID-19, we're seeing 5 to 6 days between successive cases, so 5 to 6 days between contracting the disease and actually being positive for the disease. For influenza, we tend to see 3 days between successive cases. That means it spreads faster. COVID-19, however, is proving to do virus shedding 24 to 48 hours prior to symptom onset, so it's harder to detect. This is what we're worried about. This is why we're quarantining. For the flu, we're seeing virus transmission in the first 3 to 5 days of the illness. People are usually showing symptoms at that point, so they know to stay home. COVID-19, the preliminary data suggests that children are infected by adults, whereas the flu, the children are the key factors in the spread. For COVID-19, it's most severe for the elderly and those with underlying medical conditions or those who are immunocompromised. Influenza is most severe for children, pregnant women, the elderly, and people with underlying chronic medical conditions or who are immunocompromised. COVID-19 vaccines are in development. Influenza, we already have vaccines and antivirals available. If you have not gotten your flu shot already, please do get it now. That flu shot will not help against COVID-19, but it will help lessen the effects of influenza should you contract it and hopefully keep you out of the hospital. It is still flu season. This flattening the curve diagram is everywhere now, and it's worth discussing to make sure we all understand why we're doing all of this work. The pink curve shows what happens if we all get sick at once. We do not practice good hygiene, social distancing, or quarantine. It looks like it's okay because then we're all over it quickly, but if you look at the dashed line, that line indicates the capacity of our healthcare system. As you can see, the pink curve will completely overwhelm our healthcare system as it stands. I would also like to point out that if the doctors and hospitals are inundated with COVID-19 cases, contaminations, and people who are just there to see if they have it, this will take away from those who are giving birth this spring, going through chemotherapy treatments, people with bacterial infections or broken bones, basically things our healthcare system normally deals with on a day-to-day basis. If we practice good hygiene, social distancing, and even a slight change in our interactions with common surfaces, for example, taking one shopping trip for a 2-week period instead of going to the grocery store 3 times a week every week, we can reduce our chances of getting sick and flatten the curve into what you see in gray. This is just below our healthcare system's maximum capacity, but that would also mean that everyone who needs assistance will be able to get that assistance. If you must go outside, consider leaving your purse, shoes, umbrella, jacket, or gloves by the door. If you live in a climate or a home that allows for it, you can leave these items outside of your home so as to reduce the chances of contamination inside the house. As soon as you walk in, wash your hands, wipe down your phone, keys, and doorknob. You might then consider wiping down any other supplies that you use both indoors and outdoors, such as a wheelchair, crutches, or inhaler. We want to be more thoughtful about what our kids take outside as well. A plastic or metal toy will be easier to clean by your front door than a stuffed animal. While this is difficult to think about for many parents, myself included, we really want to avoid going on trips, having parties, or even having play dates. If you must have a play date, consider that degrees of separation exercise and have just the kid over or the kid and one parent. This is really only advisable if it is considered low risk for your area and it is needed for mental health reasons. Otherwise, let the kids have a Skype play date. I know my daughter thinks funny pictures on the phone is a lot of fun, so my family, you've been warned, you're going to get a lot of photo text messages. Another thing to think about is if your school is closed for quarantine purposes, please do not negate the efforts your school is putting in place. We should not be going to playgrounds, having parties, or play dates. Try to keep your kid at home. Finally, we want to consider our daily routine. If you wear contact lenses, we want to scrub our hands before taking them out or putting them in. If you wear glasses, you'll want to disinfect those regularly throughout the day. We tend to fidget with our glasses without realizing. Also, if you wear makeup, consider stopping altogether or minimally avoiding the use of makeup around your mouth, nose, and eyes. Thank you so much for listening to this module on degrees of separation. Please feel free to email me if you have any questions, personal or otherwise, about this presentation at samantha.lishtak@absoluteehs.com. Feel free to check out my website for the full-length 45-minute webinar that was previously recorded with a lot more information in it. I also have other small modules on this topic that are posted. Finally, please consider supporting my small business at this time, particularly if you found this information or the worksheets and documents on the website helpful. Donations can be made via PayPal or through Venmo to Samantha-Lushtak, Lushtak. Stay safe and wash your hands.